Hello, this is Dr. Paul Chang, and I welcome you all back to the Flourishing After 50 video series. Today, we're going to talk about what you need to do or know to ask when you go see your doctor for the annual physical exam or the annual well visit. I made this slide specifically for you so that you all could print it out and hand it to your doctor and make sure that those are the things that's being addressed. Now, for me, I would like to dive into a little bit more about what is a good weight for you. And I think that for medical purposes, if you take your current weight and you decrease it by 25 pounds, you are well getting to the goal medically that your body likes. You do not have to get to the weight when you are 18 to stay healthy. By the way, I gave you the formula for ideal body weight. If you really want to do it, you can go ahead and calculate it for yourself. The more important thing is the blood pressure. I need you to have that repeated in the office 3 times, average it. The normal blood pressure is 120 to 130 on the top number and 70 to 80 at the bottom number. If it is high, you really should be treated with medications now because you do not want to have a silent stroke or a heart attack that comes on easily if the blood pressure is high. And you can always taper yourself off these medications when you start losing weight or take care of your diet. Now, there are certain blood tests that you probably should do at our age of greater than 50. One is a sugar to make sure you do not develop prediabetes or diabetes. You always should check your thyroid once a year because it controls your memory and how good you feel. Chronic kidney disease is a silent killer, and so you do need to have your kidney function checked and the urine to make sure you don't have it. Last but not least, of course, is the cholesterol. Because if it's sky high, you don't want to delay your treatment till you get your first heart attack or your stroke. So these are the things that I insist that you probably should ask your doctor to get it done once a year, because at our age, we have more skin cancers and melanomas now, so you do need a skin check. And if you are not sure, they should give you a mental health screen to make sure you do not have depression that should be treated, or you won't sleep well and you will feel awful and you don't know why. Once a year, you have to have your eye checked because glaucoma and macular degeneration is usually silent till you suddenly can't see, and you don't want to wait till that happens because that's too dangerous. It may not get better. Dental exam once a year to make sure you don't have any silent abscesses that may cause you to feel awful all the time. And be truthful to yourself. You really can't hear. You should get the hearing test done and taken care of so it will not affect your health. Now, as far as vaccination at the age of 50 or higher, you should probably continue your yearly flu shot and COVID update. You should have, by now, you should have at least 2 doses of shingles because if you come down with it, it's going to hurt like the dickens and it will make you feel bad for more than a year sometimes. Now, if you don't believe me, the people die of these pneumonia and the RSV pneumonia. So those are the 2 vaccines that I strongly suggest you get it done. And the number there, 23%, 25% are death. And the first year, they get admitted to the hospital. So those are serious infections. Other screening tests, it's not something you have to do yearly. That depends on you, your risk factor, and your family history. So do ask your doctor to look at it and decide how often you should get that done and make a note of it for yourself. In summary, I think that you need to know all those so that you can control your own care. Those are the minimum steps that you probably should do at the age of 50 or higher. And next time, we're going to talk about drink up and value of vitamins. Do they really help you? If you feel like this is really helpful to you, please hit the like button, the thumbs up button, and then recommend it to your family and friends. If you have a question, please email me there, and I will try to answer to the best of my knowledge. In the meantime, I will see you again with the next video series in a week. I thank you for your attention, and may the force be with you.